Mistakes that I have made, worry of the things that cause me pain. I am not the pieces of the dream I left behind. I am light. I am light.
And we're excited to have you here.
I am light. I am light. I am light, I am light. I am not the color of my eyes. I am not the skin on the outside. I am not my age. I am not my race. My soul inside.
Go ahead and get ready to transition to begin the Welcome, everyone. Thank you so much for coming. I am Nicole Jenkins-Rosenkrantz, and I will be one of your co-hosts. I also sit on the YWCA board and on the Racial and Social Justice Subcommittee. Thank you for coming.
Good evening, everybody. My name is Shari Clarke. I work at Eastern Washington University as their Vice President for Diversity and Senior Diversity Officer, but I'm also a diversity consultant and avid blogger. We are delighted to have you with us this evening. Let us begin with a welcome and land acknowledgement. Welcome, everyone. We would like to begin this event with a tribal land acknowledgement, because although we are not gathered physically together, we believe it is extremely important to acknowledge that the YWCA of Spokane resides on the traditional homelands of the Spokane people and other Indigenous people who are connected to this region.
We wish to recognize the Indigenous peoples who have been dispossessed and displaced from their ancestral and spiritual homes and taking of their land through colonization. We recognize that land acknowledgement is only a first step towards honoring the contributions of Native Americans and Indigenous peoples today, and continue to strive towards policies and practices that bring about justice and reconciliation. We respect and honor the first people of this land, past and present, on which we advocate, work, and live.
We would like to take this just a moment to say thank you to our event sponsors, Providence, Avista, Empire Health Foundation, Community Building Foundation, and Macaloon Law, without whom this event would not be possible. Thank you all so much.
We also want to thank YWCA Spokane's Racial and Social Justice Committee, who have been working on this event tirelessly.
As a special thank you to our panelists, moderator, and all our participants for taking the time to be part of this courageous conversation this evening. We are grateful to each and every one of you. Also, we want to encourage you to take self-care during our time together. Whatever you need to do to take care of yourselves while we do this incredibly challenging work, please feel free to do so.
So with that, we will go ahead and transition to our local artists. So we are excited to celebrate 5 amazing local artists with you tonight. These talented individuals will be entertaining you through a range of styles, including rap, song, and spoken word. Please note, some performances include religious references, explicit language, or content that may be sensitive in nature and is a reflection of each artist's own perspective and desired form of artistic expression. So with that, our first person will be Poetry in Motion. These are artists that are very passionate about our city and our state and us in community. Thank you.
We, the people, declare today that the most evident of truths
Capitalism, terrorism, all the isms. All lives matter, a truth that isn't. Our history is hidden. So now we on a mission to uncover the truth. They try and bury the proof, try and change up the rules. Deny us the tools, they want us to lose. Give us guns and booze, don't cover our news. Force us to move, but here's what we do. Organize protest, resist the resistance. Provide assistance, run for Congress, control our dollars. Be entrepreneurs, our own damn bosses. We better together, we better together, we better together. We better together, we better together, we better together. Less eulogies, more unity. Less eulogies, more unity. World
Grow
peace.
together in unity, strong foundations, strong community. Live life, let love. Live life, let love. Grow together in unity, strong foundations, strong community. Live life, let love. Live life, be love. Hey, yeah. Better together. Hey, yeah. Better together. Hey, yeah. That's unity. Hey, yeah. Unity.
We better together, we better together, we better together, we better together, we better together. Less eulogies, more unity. Less eulogies, more unity. World peace. Demonstrations across the nation. On our knees and we praying for changes. We campaigning against hatred. This world is what we make it. So let's get back to the basics. Put a smile on our faces and all sit at the table. We all label, erase labels, dismantle systems of oppression. Switch direction, no microaggressions, just love and affection. Here's a life lesson. We all connected. Open your eyes and see the same reflection.
When your mind's right, you move differently at the speed of light. Become peace with me, ducking, dodging, depression every day. This endless struggle, darkness, stay away. These thoughts become things, these artists create a conscious community, a place that we all can feel safe, a place that we all can feel love, a place that we all can be safe, a place that we all can be love, a place that we all can feel safe, a place that we all can feel love, a place that we all can feel safe.
We better together. 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 Less eulogies, more unity. Less eulogies, more unity. World peace.
Thank you so much, Poetry in Motion, and we really are better together. Our next artist is T.S. The Solution, a local entrepreneur, audio engineer, and hip-hop artist. His lyrics pair emotion and wisdom to create a style of songwriting that has a mellow vibe while also cutting right to your heart. T.S. The Solution.
Listen. Read a text, told me stay dangerous. Too many gunshot cases. You smell the blood in the air. It ain't your typical fragrance, a combination of hatred and being over anxious. Talk to my minions of facts over opinions. Stats for your position, action over intentions. Gotta see it to believe it. You can keep your promise. And you can't sit at my table. You don't sit well with my conscience. Y'all be calling me bro, but all I see is foe. Follow my words, is where I go is on the need to know. Call it intuition, see the distance of these so-called friendships. Fuck it, I gotta end it. My brothers from different mothers pick up the phone to check for me. Hey, food for thought, we share recipes. I got Q on speed dial when my life is in jeopardy. I got James on speed dial for the spiritual weaponry. I got P on speed dial talking business and equity. Would have Wave on speed dial, but we talking telepathy, they already know. Same thing with my sister, she already know. Hey, same thing with my wife, she already know. Heavy load built to my shoulders, I built the nation. My legacy before emancipation, way before the plantation. I was a patron like my people, I ain't need a piece of paper to go tell me that we equal. Oh, how evil do you gotta be? Hitting cameras like fuck your privacy, you got something we gotta see. If you don't share it, then your importance is obsolete. You ain't posting a while, we had thought you died in your sleep. Nah, I've been home more than often lately, but far from lazy. Noisy daddy drive daughter crazy. No matter how big you get, girl, you always gonna be my little baby. Know that even when you angry that you can't escape me, because I'm full-time daddy, had a house on the Addy, and my son got game. I'm talking Fortnite savvy, mathematics, we practice, that's on a daily basis. Got it down to a science, numbers doing the matrix. Raising humans while raising the bar. And false conclusions doesn't mean that you know who we are. I guess it's business as usual, defensive and delusional, but claiming that you're beautiful, middle finger to your approval. This type of honesty is brutal, I ain't saying shit unless it's useful. No more question in my life, and if it matters, if you got something to ask, cause you could go and take that shit to Google. Toodles. Yeah. Country burning while I'm unlearning. Old heads look at me like young vermin. Urban. Gotta prove that I'm a person, and you mean to say this shit is working? Last night my twins cried watching Just Mercy. Having that talk more than hurt me, and tears build in my eyes. My vision got blurry, told them don't worry, cause you was built for this controversy. Y'all not hear me? Hold on. Listen to this. Country burning while I'm unlearning. Old heads look at me like young vermin. Urban. Gotta prove that I'm a person, and you mean to say this shit is working? Last night my kids. Having that talk more than hurt me, as water drips in my eyes. My vision got blurry, told them don't worry, cause you was built for this controversy. Yeah. We know what's going
on. Thank you so much, T.S. The Solution, for sharing your treasure with us. Next up, we have Elisha J. Mitchell, who is a gospel singer, worship leader, teacher, and choir director who creates music to heal and uplift. Her most recent studio album came out in the fall of 2020. Thank you, Elisha.
You know, every once in a while, we get some negative thinking up here, and it takes up precious real estate. But today we're gonna clear the way so we can all take the high road. Are you ready? Come on, let's go. In order to change your direction, you got to change your mind. Things to get any better, let truth replace lies. Change your perspective, take back thoughts and hold them captive. Overrule every objection. Change your mind, realign. Narrows the road, lighten your load, cast off the weight, lay aside sin, put on Christ and don't you take him off. Let this mind be in you, that is also in Christ Jesus. Thoughts against God's holy will, bring them all into obedience. Change your mind, realign, narrows the road, lighten your load, cast off the weight, lay aside sin, put on Christ and don't you take him off. Let this mind be in you, that is also in Christ Jesus. Thoughts against God's holy will, bring them all into obedience. You got to realign, narrows the road, lighten your load, cast off the weight, lay aside your sin, put on Christ and don't take him off, don't take him off, don't take him off.
That was simply beautiful, Mrs. Mitchell. Thank you so much for sharing your powerful, God-given voice with the rest of us. It is now my pleasure to introduce Kailee Haong, who has an MFA in creative writing and is a literature columnist for Spokane Coeur d'Alene Living. Today, she's reading a personal story taken from her thesis. Kailee?
This is called Things We Can't Pronounce. I sit next to Mama on our cracked brown leather couch, knees drawn into my chest. Gong Gong sits on the adjacent couch. What I hear, words flowing out of the large speakers that sit on either side of the TV, a language foreign to me. Chinese soap operas singing something like that. The gentle sounds of a lychee shell cracking, falling into the bowl in front of Mama on the floor. Gong Gong coughs and reminds me that he's there. I hear the flick of a lighter, watch smoke trail from the end of his cigarette. This is our sacred ritual. We can't speak to each other. Tongue-tied, I fumble the pronunciation of shishie, thank you, when Mama hands me a peeled fruit and Gong Gong pours me a small cup of green tea. I tell them thank you in Mandarin and they tell me they love me in English. This is how we communicate. These two phrases, uttered quietly, thickly accented in the living room we share. I want to talk to them. I want to ask questions, and sometimes I think I can see them want this too. I learned about Chinese death rituals too young, both of my grandparents gone before I finished learning to count to 10 in Mandarin and Khmer. I could say thank you. I'd been conditioned to say that my whole life, but I couldn't say goodbye. The foreign words like lie on my tongue. At their funerals, I was frozen. I didn't understand death at that age. I didn't understand how I could feel so upset about losing someone I could hardly communicate with. And I definitely didn't understand the trauma my grandparents endured and took to the grave with them. In the 1970s, nearly my entire family on my father's side escaped the genocide in Cambodia and were able to make it to the United States together. An incredible feat for the chaos that ensued during this time. Once on U.S. soil, their experiences became something they couldn't pronounce. And since we, the children and grandchildren born from this generational trauma, didn't have the language in our mouths to ask questions, our family's past became something we couldn't pronounce either. I know that my family made it to the U.S. safely. I know there were probably bumps in the road, close calls, haunting images that may never leave their minds. What I can't imagine is evacuating home in a hurry, corralling all of your kids and gathering possessions, only what you could carry, leaving everything you've ever known, walking for miles, trying to stay together, mostly staying together but losing some, inevitability, crossing oceans onto foreign soil, trying to explain yourself to people who don't understand, opening your mouth and feeling like nothing is coming out. Sometimes I want to ask my family these questions, pry open their experiences and read them like books, devouring every word. I want to ask, hey, what was it like? What do you remember? But I always stop myself. I know they don't want to remember. I may not understand my family's experiences in coming to the U.S. I may never understand. But what I do know is upon entry into this country, the United States Customs and Immigration Services misspelled my surname. Communication error, bureaucracy, whatever excuse you like. One half-assed shift turned Huang into Hong, and from that my American family was born. A history and a past wiped away with two messed up letters. I may have never gotten the opportunity to ask my grandparents about their lives, about our history. I never got to sit down and listen to them tell me their stories, but I have memories and images of them in my head that I will keep with me forever. I remember shimmering red envelopes, a buffet of food arrayed in the dining room, loud chatter and kee-pow, and making up a dragon dance with my cousins, performing it with so much joy our faces hurt from smiling and laughing afterwards. The crisp $10 bills Mama would slip us every now and then, beckoning us into her room to give us this unspoken gift and shooing us out like nothing happened. I remember theorizing with my sister and cousins that Mama was really a secret government agent with a money printing machine in her bedroom. How else did she give us bills so perfect, so untouched? I remember the scent of incense filling my lungs, every cell in my body. I can count in these languages spoken only at home. I can sing Liangjiu Laohu to the tune of Frere Jacques. I've been told that the song translated into English doesn't really mean much, but I know that it put me to sleep night after night as a baby. I know that breakfast congee tastes better when you load it up with dehydrated shreds of pork. I'm a vegetarian now, but sometimes think about how many times my sister and I would sneak into the kitchen, unscrew the lid to the pork, and steal a handful as a snack. I know that no one makes egg rolls like Mama, and I'm mad that nobody learned when they had the chance. I'm mad I didn't learn when I had the chance. I remember what it was like seeing a hearse for the first time, seeing an open casket, kissing Gong Gong's forehead goodbye, bowing, a long funeral ceremony in a language I didn't understand. The sparkling black granite of the headstone, Mama and Gongong's faces engraved in rock, smiling back at us, telling us they love us in English, Mandarin, and Khmer, telling us they love us in a way that transcends language, telling us they love us and they'll protect us from the things we can't pronounce.
Thank you so much, Kailee, for sharing that with us. That was beautiful. Next up, we have Tyler Alai, brought her chill soul folk tunes to Spokane from Hawaii several years back. She creates a sense of intimacy and peace in her music.
So we can be
Tyler. That was just gorgeous. Thank you so much for that. With that, I would like to thank all of the artists and also Carly with Lucky You, where most of the artists filmed. Thank you so much for helping us with this. As in everything, it takes community, right? So thank you. So to give you an overview for the rest of the event, tonight's discussion is going to include 3 sections: defining the problem, outlining potential solutions, and then answering some of the questions you have in real time.
And just a few Zoom features to keep everybody up to date. As a Zoom webinar participant, your camera and microphone are automatically turned off. As questions come up, please enter them into the Q&A box at the bottom of your screen so that we can answer as many of them as possible. And also, please feel free to utilize the chat feature to share any thoughts and observations that you might have and communicate with your fellow attendees.
Thank you. Okay, so now to introduce the topic. So we're talking about racism as a public health crisis. So first, I want to just break down what is a public health crisis. So the problem affects a large number of people. It threatens health over the long term, and it requires adopting large-scale solutions.
Exactly right. And why is racism such a public health crisis? It places an increasingly large burden on society with systemic historical racism. It impacts certain parts of the population much more so than others through discrimination. There's evidence that preventative strategies could help and that racism can be solvable. And these preventative strategies are not yet in place. And that's what we struggle for on a daily basis.
So racism is making all of us sicker by perpetuating long-standing systemic health and social inequality through restricted access to environmental factors, such as housing, transportation, education, nutrition, clean air and water, economic opportunity.
And it's now our pleasure to give you the opportunity to hear from some of our experts in medicine and public health, who will help us grasp these issues and how it is affecting communities here in Spokane, as well as communities across the state of Washington.
So now I'm going to introduce our moderator, Malisea Gardner. She is a native of Spokane, graduating from both Ferris High School and Eastern Washington University. Having spent her early professional years in Maryland, she has worked for National Institutes of Health, United Way, and most recently as an independent contractor with her own consulting business. Currently, she is the Director of Communication with the Spokane City Council and serves as a member at large on the executive committee of our local NAACP. A freelance writer, you can find Lisa's work in the Black Lens, Spokane Living magazine, and on the Visit Spokane website. With that, I will hand it off to you, Malisea.
I'm here, but I'm waiting for the host to allow my camera.
Thank you. I was just getting ready to break out into song as we were waiting for the transition, so I'm glad.
I was going to help you, Nicole.
Thank you for that introduction, Nicole, and thank you, Dr. Clarke. It's good to see your faces this evening. I am so happy to be here with you all in this space today. Our panelists, Dr. Connie, Lydia, welcome. I'll have you introduce yourselves in a brief introduction and a bio of your background and your professions.
I guess I'm going to go first. We didn't work that piece out beforehand. So I'm actually going to introduce my way by a story. And so I think it's really kind of a story that's really relevant right now. One of the reasons that I do equity work is when I was about 12 years old, my Uncle Billy was shot and killed by a Los Angeles police officer. And my family had a wrongful death suit, and we settled out of court. And in some ways, it really kind of broke my family. And the interesting thing is, if we look around today, he was a young Black man. He had some mental health issues. He was unarmed. It could be something that was the same thing that we saw last week or 2 days ago. And so what I did kind of with that information or kind of that mindset is it really kind of started to frame how I saw the world. Because when I was going to his funeral, beside me are police officers, and they're protecting the family because the community was up in arms. And for them, Billy was a symbol, but he was just my uncle. So it creates a sense of confusion. But it was also that money that allowed me to go to school and to get an education and eventually to kind of, create public health as a career. And over that whole time, I have seen so many things that are still the basis of that inequity. My stepbrother died from HIV. Well, actually, he died from I forget the way to say it, an opportunistic infection, which is really what you die from, not the HIV. But one of the things that was profound is my family, when he died, couldn't even say at his funeral that he had HIV. And at that time, I was working for the Department of Health as an HIV community planner. But the stigma in my community was profound as well as external. And then the last one I want to put in there, because it has a health focus, is my uncle, another Black man, recently died. And he died because he had a massive heart attack. And so it was the heart disease, but what actually was the problem, in my perspective, was he had been feeling bad all weekend, but he didn't want to go to the doctor because of his experiences with the healthcare system. And so I've kind of traveled around, and I could tell you the different places I've worked or the different titles, but I think it's less important to really say that for me, it's a mix of that professional and the personal that keeps me coming back to, we need to unpack the underlying conditions and not just focus on individual health problems. There's something systemic that's profound. And I'm not the only person. I'm like so common. I think if we were to poll any person of color and look at their families, that they can tell these stories and the through line that runs through it. And we don't often get to really try to work on those root causes. And I think that's one of the wonderful things about events like these, is that we actually get to unpack and try to figure out what can we do differently.
That's very profound. And you're absolutely right. There's something that's underlining, and we have to get to the root of that. Thank you for sharing that. Dr. Connie.
I love to take deep breaths. Thank you, Lydia, for honoring and sharing both what you said, your professional and your lived experiences. And I want you to know I'm listening to every word. I am comfortable being referred to any part of my name. My name is Dr. Connie Kim Nguyen-Truong, but the actual Vietnamese pronunciation is Connie Kim Nguyen-Truong. I'm finding that it's okay for me to share both what I think is okay to pronounce my name. And I remember sharing my name, and it took time for people to write that down because there's a spelling that comes with it too. And I identify as Vietnamese American, and my husband and my children are Vietnamese Chinese. So we identify with the community that has been targeted for bringing the COVID-19 virus into this country. I will share more later, but I bring that up because it takes a lot of courage to wear my color on my skin physically, and also needing to create that safe and brave space to know that this is something I live metaphorically every day of my life. And I am happy to share and proudly to share, and not because I think I'm bragging, but I think it's important to speak truth. I was recently granted promotion to associate professor with tenure. And then I learned that the percentage is low in terms of persons of color receiving tenure. Oh, that has been an incredible journey of my life at Washington State University. I'm in the College of Nursing, and it is possible because it takes a village to bring up someone, as well as in the workplace as well. So I want to be respectful of that. And I'm also a faculty affiliate in the Elson S. Floyd College of Medicine. And that is a thank you to the MD candidate who identifies as Laotian American. And she took a road less traveled for her scholarly project to outreach into the communities. And her story is very inspiring about the underserved needs in regards to cervical cancer screening disparities because of the stigma, the taboo that comes with that as well, and the systemic aspect. There are other hats that I wear, and I will integrate that in as we move along, so then that way I can share that more. But I want you to know I'm so deeply honored and grateful. It was a DMP student. Shout out to Cameron Maliki for reaching out, and he's doing his DMP project with the YWCA in Spokane. And I was like, I wouldn't even think of not saying yes. It was just so compelling. So I want to make sure I stay very humble and appreciate how I even came to be in this space with everyone. Thank you.
Well, we're absolutely honored to have you, Dr. Connie. Thank you. Thank you so much for sharing your story. And we're actually going to, this is a good segue, because one of the first questions, and it's actually a two-part question that I have for both you and Lydia, it's how does racism and health inequity show up in Washington State, but also how does it show up in your professions? And Dr. Connie, I'll let you start with this.
Thank you. Another part of my sectionality, I'm being a proud, this is like Asian pride, person of color pride here, is I'm also I identify with the community who identifies with disabilities, persons with disabilities. So I have that as well. And I also am developmentally delayed. I think this is the most formal space that I have ever shared that out loud. I share this because this is one of the inequities within our state. And also I do work in a neighboring state, Oregon, because I'm located in Southwest Washington, but we're one college, so we reach all the way across to Eastern Washington as well. So that is something that is of concern. And the neurodiversity, although there's been research around, for example, autism spectrum disorder, which is a neurobiological developmental disorder, but the topic doesn't get spoken as much. And there's our children, our families, who's caring for our future. There's a delayed diagnosis. My question is, why is this happening? And there's a criteria that one would need to meet medically and also in the school system to even have that recognition of whether a child has ASD. I've had conversations with both the president of the national, in terms of the Pediatric Nurse Practitioners Association, about why is there a delayed diagnosis and what's happening to our communities of color. And there's the disparities, and there's the science part to it. So there's discoveries being made to make that diagnosis, but it's not really being spoken about. There's like this unspoken, and children may be coming across as looking as though they have behavioral problems, and children are being misunderstood, and they're not getting the resources they need. My own son, I have twins. He had a delayed diagnosis. I am a nurse. And first and foremost, I am his mother. I thought something was not right. I was like, something's not quite right. And I had the conversation with the nurses. I had a conversation with providers, and they were validating, they were in agreement. But I wasn't really like hearing things getting documented, not because they didn't want to, but there wasn't like policies, procedures at that time. And that wasn't that long ago at the place that we were at. So because I am a very persistent person, and I was like, I need to make sure that I advocate for my child.
And do you feel that racism is the underlying reason for the delayed?
That's a part of the contributor. Like if this is what I would hear is, this is what happens to boys. Like I would hear that, like as though there wasn't anything other than that explanation. And that's what I kept hearing time and time again. The other concern in our state is adverse childhood experiences, ACEs. There's a lot of work that's been done by Dr. Nadine Burke, and she's also presented TED Talks and at World Health Organization. She herself identifies as a Black woman of color, a pediatrician, and she had to come up with her own tool to be able to assess how many numbers of ACEs, and if there's 4 or more, then the child is going to be at risk in terms of growing up with adult chronic health conditions. There's pivotal research that has come out from Kaiser Permanente too, very groundbreaking about that. The question is, why are we still not fully addressing ACEs? And what does that mean for our communities of color as well? Like with the Micronesian Islanders in Washington, that has been concerns that has been brought up in the school system and also public county, and they're struggling to try to connect to gain entree into the Micronesian Islander community. And so that's the part of where like being able to immerse and really hearing the story of what our families and what's our children are saying. So I'll pause here because I'm thinking that Lydia will have things to share.
Yes. Lydia, how do you see it showing up in your profession?
And so I didn't tell people my current job. I am the equity and I'm one of the equity and social justice managers at the State Department of Health. And so I'm going to answer this kind of like you would expect a public health, statewide professional to answer it. Is I'm first going to say that health equity, because I'm going to talk about what the difference between equity and inequity is. It exists when all people have the opportunity to achieve their full health potential, regardless of these things that I'm going to talk about. The color of their skin, where they were born, the level of education, their gender identity, the sexual orientation, religion they practice, the jobs they have, the language they speak, the neighborhoods they live in, and whether they have a disability. There's more things than that, but all of those things are inextricably intertwined, at least in the US, with race. We have to take an intersectional approach, and we have to look at race. We have to look at all the other isms, for lack of a better word, and how they interplay. And like one of the best ways I can tell you about how it shows up is to give you an example. So I can pull data by zip code across the state, and I can find the neighborhood that has the highest obesity rate in the city. And typically, when I do that, it's also the neighborhood with the highest proportion of people of color. The people in that neighborhood are there because of residential segregation practices. The neighborhood also may have no parks or sidewalks or limited access to healthy foods, which are all built environments or environmental factors. There may have been like a city council meeting or commission, and they may have never had a representative from that part of the city. And where the wealthier white neighborhoods may have more than one representative for parks and sidewalks and bike lanes and farmers markets. And so when I look at that, yes, I'm talking about all those other isms, but it's a mixture of all kind of the systems that have happened. And if I were really going to try to break it down, I would say there's a systemic piece. So there's these decades of residential segregation practices that led to the economic and racial and health inequity. It was avoidable. Is the other thing I want to kind of put out there is the higher obesity rate could be avoided through environmental changes. It could be, there could be bike lanes and supermarkets and working with people to find out how the foods that they grew up with could be made more healthy. So it's not that we have to die that way as people of color, it's avoidable. And that it basically rolls down to it being unfair and unjust, because it is about the distribution of resources, and those resources impact our health. So I realize that's a very governmental public health answer, but that is where I work right now.
But you're spot on. Thank you. That was, and how do you feel that it relates to our particular state here? Let's localize that to Washington. How do you think that it plays into Washington State?
Well, one of the things is in Washington State, we typically like to imagine that we do not have the disparities that exist in other states. We have the same disparities in hypertension. We have the same disparities in HIV. We have the same disparities of COVID. If I take the percentages for maternal mortality rates, whether we live in Washington State, the experience of brown and Black folks has the same disparities of people that are living in, Georgia. I can pick a southern state because a lot of times people think that the South is different. Also, if I actually go more regionally and I pick Spokane versus Seattle versus Yakima, I can find the same health disparities whether you're on the west side of the mountains or the east side of the mountains. Unfortunately, it is ubiquitous. There may be some differences in percentage points, but I have not found a health area in Washington State or Spokane or anywhere else that does not have the same disparities. So all that's different is possibly the rate of disparities.
Now that we've framed and localized the crisis, I want to talk about where we go next. We want to talk about solutions and moving this forward. So earlier this month, the Center for Disease Control and Prevention declared racism a public health threat in Washington. And in Washington State, various county boards of health have already declared racism as a public health crisis. Do you agree with this? Some people would argue that it's not a public health crisis, but in this 10 minutes, you both have proved that it is. Do you want to comment on this revelation and that it is this public health crisis? Dr. Connie, I'll start with you.
It's about time. I've been talking with community leaders and I'm also grateful to listen to the students that I work with as well. And this has been a long time coming to have the formal recognition. Back in 2019, which was only 2 years ago, the American Academy of Pediatrics, they've made their article very public in terms of declaring racism as a social determinant of health.
Mm-hmm.
So it's very groundbreaking. And then 1 year later in 2020, they had a very, the American Pediatric Academy, very public about truth and reconciliation and a pathway to equity, because they said that with their own academy, they said we are not immune to racism. They shared very explicitly in the article the meeting minutes, what was happening both individual and systemically in terms of even the interaction with scholars who identified as Blacks coming into the academy. And in the meeting minutes, they was brought up about the concern about how the scholars may want to have and to sit close by to have lunch, to like have a meal with them, but that we would designate a place for them to sit. And this was among scholars.
Mm.
And the National Academy of Science recently has released in terms of a report of research that has been done decades, and they have these statements, extractions of these key racism issues that's been happening in the individual level as well as systemic level, and they organize it as these call outs. And it shows it takes time, even in the world of health and science, to be able to have that. And earlier this year, there's a National Commission on Racism in Nursing, because in the profession of nursing, we also are not immune to racism, even though that's something I knew of when I went into the profession. And research that has been done with nurses who identify as persons of color, even during the pandemic, and not being able to have that option to work remotely as others.
So as we go into this portion of solutions, there's some great questions that were submitted online by our community members. We want to encourage you to continue to submitting your questions in the Q&A box at the bottom of your screen. We will be answering those questions, so please keep those questions coming. I will try to get through them as we go further in the conversation. So the next question that I have for our panelists, we've talked about health inequity, but what would health equity look like? Are there any model policies or frameworks out there? And how could we be implementing at an organizational level? And Lydia, I'll start with you.
I think there are some frameworks that we can look to. I think one of the frameworks is what I would actually call acknowledging race and place. And what that means is when you're designing programs and policies, that you are allowed, or encouraged is probably a better word, to specifically consider race and place in developing that policy. So what I'm saying is it's not about having the same policy. It's not about equality. It's actually creating more supports for folks based on where they live or the color of their skin. And that's trying to be specifically anti-racist as opposed to being what people might call non-racist. And that's not so much a policy, but it's a framework that we need to kind of adapt if we're trying to unpack this. And I don't know how much folks are familiar with Kennedy's work, but one of the idea, Ibrahim X. Kennedy, but one of the premises is that if a policy or a procedure creates a racist outcome, even if there's nothing that says it's for a specific race, it is racist. So you look at the outcome. So there aren't really policies, if we want to break it down that way, that are race neutral. Things either create help or they create harm. And that anything that creates harm along racial inequity, that you actually have to actively unpack it. And I think that for me is the biggest framework or the biggest kind of policy. There are things about addressing implicit biases for providers that I think are helpful. But even those actually have the same premise of being actively, and I use the word active, anti-racist, and getting rid of the illusion of neutrality when it comes to issues.
I'm muted. And do you think that there are any policies out there that we could implement?
It depends on whether you're saying policy big level or like policies and organizations. I think it's much easier within individual organizations. Some of the things that we do or at the state organization level is I have a tool that's a health equity review tool. So no policy can go by without passing that tool. I have an equity and contracting tool. That means if I'm contracting with community-based providers, I have to make sure that I'm contracting with providers that look like the communities that they serve, that I'm specifically setting aside enough funding to address those. And I know that for some people that feels uncomfortable, but it's a matter of investing the right amount to fix the issue at hand. And so those are kind of the like the policies I can think of that are really tangible. There are also things about using disaggregated data as a policy. And so that you understand exactly what populations, like if you look at what's going on right now with COVID-19, you could talk about all communities of color, but it's really Pacific Islander, Latinx, and Black folks are amongst all of the people of color. And then what you want to do is direct your program not toward all people of color evenly in the same way, but what are those specific community solutions that resonate for those communities? So the other kind of policy would be developing very kind of micro level solutions for the individual community in which you are trying to create change.
So before I give it over to Dr. Connie, I see a couple of our participants, they're raising their hands for questions. I want to remind you all to please drop it in the chat box and I'll read your questions for you. Now, Dr. Connie, what would health equity look like in the state of Washington?
Thank you. I'm gonna add to what Lydia, I was so grateful to hear you mention about disaggregated data in terms of policy, because that was on my list to mention. And so this is where, in thinking about like who's at the table. When I was in my program of doctoral program study, and even then back then in terms of my pre-licensure, I didn't really quite understand what that metaphor meant until I was like, I literally was not sitting at the table. In this case now, it's at the Zoom table. And that's actually continues to be an important question whenever thinking about inclusion and exclusion criteria. And that's language that's used in science in terms of the study design. And most of the time, what I continue to see is if someone is able to speak English or read English and not giving that opportunity for people to choose. So in terms of programming, I'm going to add to what Lydia had mentioned. I do a lot of work with in terms of community-based participatory research. And I was told I was one of the brave students. This was when it was still early in the early 2000s. Like, oh my gosh, I'm going to give away my age pretty soon here. And there was one other student that had pursued that, and Drs. Minkler and Wallerstein had published a book about the importance in terms of thinking about those agreements, those principles, to be able to work alongside with cultural community leaders or members, and what that would mean too in terms of power sharing, the balance of dance, and equitably involving throughout the research process, or in this case, research or in terms of programming. And that takes time. When I have conversations with folks that they're like, there's these unforgiving deadlines. I was like, well, is there any way to be able to outreach, to have a call out to our leaders at community organizations? And then there may be community health workers who are trusted and they're working in the communities. Is there a way to be able to engage them, to be at the table in terms of what are we not hearing? Because not everything gets published and written. There's the storytelling, the oral, the listening sessions. So that's what I learned from cultural community organizations, is the importance of the oral storytelling and being present and seeing if you can build trust and rapport to make that connection. But to not make an assumption that if you have someone on staff or someone in the leadership who identifies in terms of sexuality that they would have automatic acceptance, that is not a correct assumption. It needs to be earned. And
I'm
so
going to
that's
read a
something I
question.
learned.
I'm going to read a question that we have in the chat. It's from Brianna. It says, I live in a rural community and I am interested on how to push for organizational community change for BIPOC anti-racism efforts in an area that is majority red, and have shown not to be receptive to anti-racism cultural responsiveness efforts. That's a good question. So what could we do in these rural areas that are a little bit hesitant in implementing anti-racism efforts?
I think that's the age-old activism question. And I think the reality is we have to start in the communities in which we live. And it's going to take a whole collective. And so it will take the work of activists. It will take the work of bureaucrats like me. It will take the work of elected officials. But it's also going to take finding those champions who you may not expect. It might be faith-based. It might be a local, girls club. And it's that thing of building coalition and ground support and boots on the ground and working through it. I know it's not like an easy or sexy answer, but it's just like you have to just keep pushing it with the hopes that eventually there'll be some movement. There is an office of state, there has been a state office of equity that was just developed, that was stood up. And part of what their charge will be is to make sure that all parts of Washington state are engaged in equity, and it's not just our largest cities. And so that was a really important thing that happened in our last, legislative session, was the establishment of the State Office of Equity, which is the first time we've ever had an office. Right now it has like 2 or 3 people, but they're standing it up.
Right. All right. And so moving along, since I see that, we're getting engaged in conversation, but we want to make sure we stay timely with our program tonight. So the next question is, what can we as individuals in a community do to combat this crisis? How can we show up and be allies in our community? And how can white folk use their privilege to uplift communities and leaders of color? Which suggestions do you have for opening up dialogue about racism with family and friends? I know that was a loaded question. I think it was a couple of them in there, but we can chisel at that question one at a time. Dr. Connie, do you want to start in any particular order of that question?
I appreciate the loaded question. Yes, there's layers. So thank you for the layers. And this also seems like it ties to one of the participants' question as well. Having the conversation that starts within family and friends network with whom there's that trust. And even then, I need to make sure I check in with my own family, what that means too, because there are different points of views. But that's something that I found to be really helpful, is to be able to have a space in which to have that dialogue. And I can see if there's areas that I myself may need to strengthen, and what I'm struggling, if I'm even trying to have this conversation with my own family and friends. And then what I do is I this is what I've been doing. I bring that out into being able to talk and reach out to organizations. That's something that I think is important, because once I did that, then they knew that, oh, you're from the community. We serve the community. Let's have a dialogue. And that showing up, that presence is really important, because it can seem really big. And that's what I kept doing. I am a natural introvert. But what I learned in my upbringing from my parents, I'm very thankful. I have a very strong spine. They sent me to children's theater. I was like, I don't know. This is like being on stage. So I was like literally on stage practicing, and I kept being assigned having the mom role. I do not know why. Maybe I just came off that way, very caring already at the age of 5, and I was able to have that. But I bring that up because that helps. The more that you show up, the presence, and talk about the balance points of view, and trying to understand the language of what people can be comfortable. And I've had conversations with my children's school teachers. Before I pass to Lydia, I want to share this briefly in the response. It's one thing for me to do research and to read it, but I really am thankful when I'm on the other side in terms of wearing my mom hat role, and I'm a very proud mama. And I'm like, oh my gosh, this is hard. And I'm asking community members to do what I'm trying to do. And my son was getting bullied. So I know I share this because I have permission. I asked him for permission if I can share a story. And he didn't have the words, but his friends in his class, social communication classes, they were his allies. They saw that he was crying. They saw that he got physically hit. They brought him and urged him to talk with the teachers because he didn't have the words. He was in shock. That is not what he was raised in terms of being physically harmed by someone. It's happened more than once. And so then that conversation happened. Children, they see and they hear things. So I talked with the teacher about how thankful I am that we can have this conversation, but the teachers kept using the term bullying. So I asked a very specific question. Of all the children, my son is the one that's a person of color. What was the background of the other child? He said, no, he's white and he's very big. And I said, this sounds like racism. And she's like, I don't think they know what that means, and said that they don't, that is not called racism. And I was like, when someone is in a position and they think that they are superior to another person and acts that way and brings harm, that's racism. And the teacher, who I still respect as of today, it was hard for her because that was not the language that was in the policies and procedures. The language was, this is what we do when there's bullying. So that other student got suspended. And I was concerned about the health of that other student and what that could mean. what about the needs of the other student, not only my son? And they didn't have a response. So that's individual racism and systemic racism right there. And I shared my physiological response. I don't think the teacher was ready for it. I said, I can feel the bounding of my pulse. Instead of a level 2 grade, it's going to a level 3 or 4. I am sweating. And I was like pointing out my sweat, my sympathetic response, my heart's palpitating. I was staying calm and I told her, I feel angry. This is my calm anger. But I want you to want to work with my family. But I need you to know I'm having a physiological reaction to what you're saying.
Thank you for sharing that. I think that's powerful. Thank you for sharing that. We have a few questions that have popped into our question and answer box. I'm going to read. The first one is there data in Washington State about food deserts and the areas those impacted?
There is data. I did not pull it for this particular presentation, but I can get you the link because it's on the in our food safety section, our food access and safety section on the Department of Health website.
Okay.
An interactive map. And so you click on it and then it tells you where all the food deserts are, is what I think the question is that's being asked.
Okay, so this one is from Kara, and it says, from what I understand, it was said that policies are racist. How can a change be made in policy making at a state level to reduce racist policies and adjust the already placed racist policies?
I think I'm going to take that one. I think what it is once a policy is in place, it is kind of a two-part piece. One, we need community to hold us, I'm in state government, accountable. And so what we basically do is you rescind a policy. So like if you look at some policies can change like legislatively, like you have something like Brown versus Board of Education, that was landmark policy change. But policies also can change on a local level. So it's your state board, it's the State Board of Health, but it's also your local health jurisdictions. It's the policies of some of your institutions. And so what it is you take each policy, you look at what the outcome is for folks of color. And if it's not getting you the outcome, you propose something to change it. And then you actively change it. So it's not like a short process. And it's one of the least interesting things in public health, but it is a methodical process. And it's one of the things we really rely on internally. When the community supports us, those champions for equity inside of your institutions, we can push so much harder when we know the community is trying to push for the same things. And so one of the best ways is to be in contact with your health department, whether it's your local or the state, to be in contact with your local political folks so that they know all of your priorities. So they know your face. They know when you're going to show up and that you're going to be the person in the back of the room that says, well, how does that impact this community? And also the other thing you need to do is just like Dr. Connie was doing, we have to share our personal stories. We have to have our personal stories as part of the narrative that accompanies the data, which is what I'm likely to bring from the state health department, because you want legislators and people who can make those policy changes to see our humanity as well as to see the data points.
All right, we have two more questions here. So how do health issues from environment pollution disproportionately affect communities of color?
The question for me?
How do health issues from environment pollution disproportionately affect communities of color?
So my short answer would be things like asthma is disproportionately impacts folks of color. There are other things like lead poisoning, which is the lead in the in our paint. Poor folks and people of color are disproportionate. So I would basically have to like go down for disease by disease, but there are many, many diseases. Environmental public health is just as much an issue that we need to address as some of the other things that we think about in public health in terms of disparities for people of color.
I think asthma, any type of respiratory issues and cardiovascular are going to be top of mind when it comes to environmental pollutants. And we're cognizant of that today on Earth Day. So those are two of the largest health concerns when it comes to environmental pollutants. Dr. Connie, did you want to add to that?
The only thing I would add is place matters. Like where someone lives. So if there's, whether it's affordable housing or a total household income can determine where someone is able to live in a setting that is either away from highway or and roadways where there's the pollutants from the car exhaust. So that's something that I continue to hear from community leaders about what that means and what are options when someone is place bound because of what they can afford. So I wanted to bring that up as a part of talking about environmental pollution.
So the next question is shifting gears a little bit from health to law enforcement. So the question is, what is the role that racism has played in local law enforcement? Who wants to jump into that conversation or that answer? Lydia, or?
I actually don't feel like I have enough knowledge of local to give an informed.
Let's go with Washington State. We don't have to do local here in Spokane, but Washington State, we saw the uprising that happened last year in Seattle. That alone, we can talk and dissect, a lot of what happened between the law enforcement and the citizens who were peacefully protesting.
Yeah, and one of the other things we're beginning to actually look at is police or state-sanctioned violence as its own public health risk. Like we look at gun violence and we look at other types of violence. And so I really do think we have to look at some of the implicit bias that is present in our law enforcement. And I know that for some folks that is I want to say a third rail or very it's a conversation we don't want to have, but implicit bias exists across, all professions. And one of the things we're looking at law enforcement is that their interactions with folks are typically on people's worst day. And we need officers when they're coming into contact with people on their worst day to be better, to not be operating from implicit bias. We need them to be at a higher standard than the rest of us. And so I do think it's a huge thing that we actually have to unpack throughout law enforcement locally as well as statewide.
And Dr. Connie, do you want to contribute to that?
I appreciate being able to reflect on the question. I do not have all the knowledge capacity to be able to respond. But in parallel, I can respond that by seeing how, like our neighbor states, for example, in Oregon, with the Coalition of Communities of Colors, the Immigrant and Refugee Community Organization, and what they've been able to do. I continue to have conversations because we have community members that are crossing the rivers from Southwest Washington into Oregon because they're needing to have resources and where they can go to trust, and they're going that extra distance. So in terms of that, the uprising, the speaking up, and to not be silent, that's been the emphasis, is to please not be silent. Sometimes I'll feel, I will hear people say, but if I feel safe, what would I need to say if I'm okay? I was like, by you speaking up and seeing and what you're hearing as an ally, you can help another person to know that if you're speaking up, it's okay for them to speak up as well, because it takes a lot of courage. And there's, that's what I wanted to share. It's not answering the question directly, but I'm very thankful to think deeply about it.
Well, unfortunately, we do not have time to answer everyone's questions at this moment, but we thank you all for who have asked these great questions, engaging questions, thought-provoking questions. So in final thoughts, as we're wrapping up, as we begin to end, I would like to ask each panelist to give any last thoughts as it relates to our conversation here tonight and taking that stand against racism. What are your final thoughts, Lydia?
My final thoughts are that no matter where we are or who we are, there's something we could be doing. There's a role for everyone. And I really believe that we all have to, we absolutely have to act. It's not enough to just study. It's not enough to have empathy. But to unpack this will require action, whether you're an ally or you're a person of color.
And Dr. Connie, I'll give it to you for your final thoughts tonight.
It is okay to be different, to look different, to sound different. There's power in difference. There's beauty when we say diversity. And then there's the practice of inclusion in your day-to-day. That deep reflection, being cathartic, that is something that I encourage for people to be able to do within yourself. And then to also reach out to peers or even someone you may not know because you're contacting, whether it's an organization or submitting a testimony. Your voice is really important. It took a lot of work from people before us to be able to even vote. And that includes women, persons of color. There's a show, Daniel Tiger's Neighborhood. My children learned about civic engagement from Daniel Tigers. It's inspired by Mr. Rogers. I grew up with Mr. Rogers. And they realized I'm not going to always get what I want, even when I voted, but I got to vote. So they've been very proud to be able to say that they voted in class for something. And then what are they going to do if they didn't get what they want? They can stomp 3 times and they'll feel better. And there's a song to it too. Stomp 3 times and you'll feel better. But it has more to do with validating yourself, and that it's, and to please see people. That's the thing. And it's really important. And to allow yourself to tap into the cognitive, affective, and psycho domains. We are whole persons.
Well, I truly, truly thank our panelists tonight. Thank you for your stories. Thank you for your knowledge. Thank you for your encouragement. And thank you for standing against racism in all of your facets of life. So now I'm going to turn it back to our hosts, Nicole and Dr. Clarke. And for our call to action, and we can learn what we do not from this event, what we can do after this event to eliminate racism. We can't eradicate everything, but we can work towards it. Dr. Clarke, Nicole, I turn it to you.
Thank you so much, Malisea, and thank you for moderating this event with great insight and empathy. We simply value and appreciate all that you do for us. After the event, we encourage you to join the pledge to stand against racism. Encourage your friends and family to take the stand with us by posting a selfie along with an action you'll be taking to stand up for racial equality and social justice today.
Also, we invite you to sign up for the challenge. We encourage you to register for the YWCA Spokane's new 14-day Racial Equity and Social Justice Challenge. The challenge was originally developed by Dr. Eddie Moore Jr. and co-developed with Debbie Irving and Dr. Marguerite Pennick. The challenge has been adapted by many organizations across the country to help people better understand issues surrounding equity, inclusion, privilege, leadership, and supremacy.
There will also be information on how to get involved with local organizations committed to peace, justice, freedom, and dignity.
Thank you all for joining us tonight for this courageous conversation. A recording of the event will be available and shared with all registrants via email next week. We will be sharing it out on our website and over our social media channels as well. If you have found it valuable, please consider sharing it with others.
My word is my power, power. My word is my word is my word is my power, power.
Stand against racism swag. Please visit promoplace.com/YWCA. Thank you.
Let me paint a picture of an A